Hello, how are you doing? My name is Dr. Joel Baumgartner. I'm a sports and orthopedic physician, and I kind of wanted to share with you my story today of how I got to where I'm doing what I'm doing today and why I do what I do. Started my clinic about 4 years ago. Prior to that, I was working in a big healthcare organization, just one of the doctors, punching the clock, trying to do my time, making some change in people's lives, I would say, but not a lot of change for the long-term good of my patients, prescribing medications, doing work in their joints, helping with their injuries, rehabbing, those kind of things. But then 4 years ago, I thought, you know what, I think I can do better. I think I can make a deeper, more long-lasting change in my patients' lives. At that point, I wanted to take the challenge of doing things a little bit differently so that we could change the way healthcare is going. I mean, if we look at where healthcare is going at this point, the healthcare dollars are being spent more and more every year towards diseases that are preventable. Obesity-related diseases like diabetes, hypertension, stroke, heart attacks. All of these things are preventable if we make some lifestyle choices, prior to those things setting in for the chronic disease causing the damage. So I want to kind of change the healthcare delivery system from a health care system to a health preventative type system, where we're actually educating people to make healthy changes, where we're taking a more functional approach to preventing disease and creating health in people's lives. I do right now in my practice a lot of regenerative type medicine, which for me is part of the whole functional medicine balance. With regenerative medicine, we're doing things like prolotherapy, PRP, stem cell injections. We're also doing a lot of restorative injections with the nerve and the nervous system to get the body to work better. When I first started doing this part of my practice, it was amazing. I felt like I was finally making some difference, but yet I still had patients that were fatigued, still had patients that had no energy, still had patients that were sleeping lousily, and patients whose pain was coming back because they were still overweight, they're still ingesting a lot of inflammatory type foods, they weren't changing their lifestyle to help create permanent change in their joints and their body. So we decided to add another component to that, and that's more the functional medicine component to medicine. Again, that's the components that are helping with prevention and education and teaching people how to make changes in their health and their lives. It's going to be more long term. So we added on to our sports and orthopedic regenerative practice functional medicine, which is hormone optimization, making sure it's your ideal body weight, eating well, learning about nutrition. And so with that as well, balancing out the functional medicine, the hormones and those types of things, was the whole medical fitness model, which is another thing that we're extremely passionate about, because you can be eating good things, but if you're not using your body right and stimulating your body to growth and repair and always challenging that anabolic side of your body, you're only going to be so healthy as well. So we really saw that triad starting to develop and how we created our clinic model. That was having the functional medicine component, talking about what we eat, why we eat it, how we do what we do to optimize our hormones, actually doing lab analysis to make sure that people's hormones are optimized to increase the function in their body. The second tier of that triad was the medical fitness side of it. The medical fitness side is focusing on how do we get people to get to their ideal body weight, how do we get them excited about exercise, and using that energy from exercise to spread that to their families and their community and eventually the world. So the medical fitness platform that we developed has a huge educational basis to it, where we're teaching people to be like these little nutty professors. They know a little bit about anatomy, physiology, endocrinology. They know a little bit about reps and sets and muscles and the function of ligaments and tendons. They know a little bit about psychology and motivation. They know a lot about nutrition and healthy eating and how to read labels and how to do a shopping tour. So we're creating these little professors that can then go spread the knowledge to the rest of the world. That's our goal, is to take what's happening here and to spread it so everybody becomes more healthy, using less healthcare dollars and being healthy in the end of it. And the third tier to our triad that we're talking about is that restorative medicine or that regenerative medicine side of things, where you're actually getting the body to heal itself. The body has amazing ability to do that. If you cut your arm, the body goes back and heals it back up. If you sprain your ankle, it goes back and heals it back up. We now have science and evidence showing that we can get the body to regenerate a degenerating knee or a tendon or a ligament or meniscus through regenerative injections and procedures. So with this triad of functional medicine, medical fitness, and regenerative medicine, it's really been one of the most rewarding things in my life to see the changes that we're making in people's lives. So it's just been very exciting. It energizes me, and I hope it energizes you as well.